In emergency situations, getting a patient the care they need immediately is very important. In Uganda, one man has designed a prototype for a medical device that may lead to quicker treatment.
Africa, if I might say, is lagging a little bit behind when it comes to innovations, especially in health. And we are talking about affordable technologies, but then also technologies which apply in Africa in the context of low and middle income countries. So young people usually have, I believe they have the brains to boost health through coming up with innovations which make diagnosis or even treatment quicker for the patients. I am a medtech entrepreneur from Uganda. I am Julius Mubiru and I'm a change maker.
When Julius Mubiru was only 1.5 years old, he spent 2 weeks in the hospital suffering from an asthma attack, the first of many.
I used to be so sick, so I'd spend a lot of time in the hospital.
Though he's healthy now, one thing that always stuck with him was getting jabbed multiple times before a clinician successfully found a vein.
I think this one, along the way, motivated me to go into the line of health. That is to try and give back a service to help with challenges which you find as a child. From the child's perspective, the aspect of being in the hospital gave me like a motivation to try and come up with a solution to help out.
In 2015, Julius and a team of engineers at the Mbarara University of Science and Technology came up with an idea to create a device that could find veins more easily.
The standard of care, or what we call the way how clinicians are currently doing the procedure, is to use anatomical knowledge. They will teach you that a vein passes here. So the A-Lite Vein Locator is used so that you can easily identify where the vein is, and you draw the blood samples or you give the medication. This means that the child will not have to be pricked so many times, which is very painful to the child, but even for the parents. Very traumatic for them to see their sick babies going through a lot of pain. Basically, this is how it comes.
Vein locating devices exist already in other parts of the world, but Julius says they aren't feasible in Uganda for multiple reasons.
But these devices do not put into the consideration the African context, both in making and also, which also translates into the costing. For example, some need more than 2 clinicians to work with them, and also the technology behind them. Some use infrared, others are ultrasound based. So you have a lot of equipment which are needed to process the images. What we are doing, we are using visible light, where you do not need extra equipment to process the image, and then also one clinician can operate it. And this is very important because in Africa, the patient to doctor ratio is very high, 25,000 to 1, so you do not have the luxury of numbers. This is how we are trying to put the African context into the design.
The A-Lite Vein Locator is still in the prototype phase, and Julius's team is constantly updating it based on user feedback.
Okay, so this one is the laboratory where the A-Lite Vein Locator team works with our A-Lite engineers.
Good morning, guys. Taking us to do some of the reviews we picked from Mbarara that may require to be adjusted.
Okay.
So from the feedback we had, you are suggesting that it would be nice to have a strap to get it like right in place. So we're trying to think about strap design that we could consider.
The idea of A-Lite came to light during a medtech hackathon where Julius met co-founder Lydia Asimwe.
The team that was forming to create the solution had to be diverse. So it needed a medical person on the team, it needed some technicians, it needed people from the business background. So working with Julius is interesting. He's, first of all, very knowledgeable of his subject matter, of his area of expertise in medicine. He's always reading, always coming up with something new, always researching. I love that about him. So with him, it's continuous innovation, continuous learning. So this device started from a very simple prototype, lab-based prototype, very huge. It has come a long way to where it is now. There are mighty men and women and organizations that have mentored us to be where we are today.
Julius and his colleagues are currently in clinical trials with their device, under the guidance of Principal Investigator Jerome Kabachenga.
Good morning, Professor.
Morning to you. How are the preliminary results?
The results were promising. We haven't at least had any adverse effects, which is a promising thing.
As a health worker, I have also been challenged with identifying vessels. The vein locator at least has moved a stage from the proof of concept to now reaching a stage of clinical trials. And I would expect that once it has passed the initial stage of clinical trials, then it can go to like scaling up, using it to a bigger number of children and see how it will work. And then, unsurprisingly, you can find an innovation like this one, which has started here, spreading all over the world.
Julius Mubiru is hoping to revolutionize the way children are cannulated in Uganda.
With the A-Lite Vein Locator, we believe that it's an impact innovation by reducing on the time taken for these babies to get treatment. We are targeting at least less than 2 minutes, and then having first needle success of up to 100%.
It's a mission that's very personal for him and his mother.
At birth, Julius was okay until he turned 1.5 years old when he got asthma. As a parent, I always felt bad when I took him to hospital and witnessed how he was injected while looking for veins. He was indeed over-pierced, and I felt so sorry. So now when I hear that my son discovered the A-Lite machine and that there would be less piercings, it really made me happy. I was very happy.
Julius and his team have been working hard to bring their low-cost, non-invasive vein finder to market for the last 7 years. They've won numerous awards and grants to help develop the A-Lite Vein Locator.
Camtech Accelerator programs where they support young innovators. It's a $10,000 grant. So we awarded that grant, and it helped us to develop the very early prototypes into when we got the second iterations. Then we've also participated in the NISIP award by the Ministry of ICT of Uganda. It was a $20,000 award, and this is the one that we used to develop into the third prototype.
They're currently in ongoing clinical trials, and today we got to see A-Lite in action at a local health center.
This is Mbarara Health Center 4. It is located in western Uganda. It's one of the centers where we've deployed the A-Lite Vein Locator for clinical trials. So usually what happens is that in the clinical trials, you have to demonstrate that it is safe, you have to demonstrate that it's not inferior to what is being done, and then you have to demonstrate the efficacy. So you're looking at the end user population. With the clinical trials, we've already been successful to demonstrate that at least it's safe to use in human beings, and we've successfully demonstrated that at least it will not be inferior to the standard of care.
We have few health workers and the turnover rate is high. You always have new health workers coming in. You may not have that luxury of experience. So we need the procedure to be as easy as possible, to be as user-friendly as possible. With this technology, when the patient comes to, can easily access the vessels instead of having that, super skilled person.
When they're not busy testing in the lab or in the field, the A-Lite crew like to get out and have some fun.
This is a team building activity which we usually do on weekends to get away from work and relax and also build a bond. Doing this activity helps the team to stay fresh and focused, and also to remove some work burden and stress which comes with project work and everything. We also do football and table tennis some of the times, though most of the team knows volleyball. The future of the vein locator device is quite promising because we believe that we are coming up with a solution which has been demonstrated from the end user feedback that it is needed, both on the side of the clinicians, but then also the people who feel the pain, that is the patients. The journey of the vein locator has given me a lot of opportunities to learn about clinical trials, but then also the ability to run projects. And I believe that this is a point which professionally can push me to even bigger projects, both on the continent, but then also on the world scene, so that we contribute to the general well-being of everyone.
Thanks so much for watching. You can always catch up on past episodes or access exclusive content on our website. I'm Aritoko, and I'll be back soon with more change-making stories.